let's talk about dental hygiene for kids. Hi, my name is Whitney, and I'm a dental hygienist here to talk about home care advice for baby teeth, toddlers' teeth, kids' teeth. So let's start with babies. Even though babies don't have any teeth, I always make sure that parents know that they still need to clean inside of their baby's mouth, even before they have teeth. It's recommended to wipe the gums off after each feeding with a warm, wet washcloth or a dampened piece of gauze. And then once the teeth begin coming in, it's important to start brushing them right away. When they're like halfway in, not all the way in, that's when those silicone brushes are okay to use, but if you don't have one of those, a regular infant child size brush is fine, maybe even better because that's what you're supposed to use once the teeth are fully erupted in. So you might as well start using it now. Those silicone ones, sometimes the babies like to chew on them though. That's fine. Some babies and lots of toddlers sometimes don't want their teeth brushed, right? If that's the case, I usually recommend trying a leg wrap, where the parent places their kid in their lap and wraps their legs around their arms. It looks wild, but it really isn't. Kids adapt to it super quickly. Also, I always remind parents to never put a baby to bed with a bottle of milk, or worse, juice, because milk and juice are notorious for causing cavities. And I also inform parents that the first signs of cavities in baby teeth are discoloration and minor pitting. So if dark spots are visible on any baby teeth, they should call and schedule a dental appointment immediately. So yes, once that first tooth erupts, we want to brush it. And the American Dental Association states that there is no minimum age to use fluoride toothpaste. So a fluoride toothpaste is recommended on baby teeth. A rice-sized smear is safe and effective to use. And once a child is 3 years old and they are able to properly spit, then a pea-sized amount of toothpaste should be used on their toothbrush. And if they are able to sit still, usually around age 3, if you want, you can introduce a children's size electric toothbrush. I will link products that I recommend in the description box if you're interested. And side note, if for some reason a parent is not into fluoride, I always make sure that they are at least using hydroxyapatite toothpaste on their kids' teeth, because fluoride-free toothpaste often only has xylitol in it, and that's not enough to protect against cavities. So I will link both kids' hydroxyapatite toothpastes, which are fluoride-free, but they work a lot better than just the xylitol pastes, and kids' fluoride toothpaste. I'll link both product suggestions in the description. Again, I'm all for using the fluoride because it's recommended by the American Dental Association, but if for some reason a patient refuses to use it, go with the hydroxyapatite. Now, we talked about the crisscross, the leg wrap, but once kids start getting older and they might start feeling independent and that they want to try and brush their teeth themselves. If so, that's actually great. I always tell parents to let them brush their own teeth. And then when they are done, I always make sure that the parent goes back and brushes all the teeth again. Kids do not have the dexterity to do a good job, even if they want to. And honestly, it depends on the kid, but sometimes they don't have good dexterity until like age 8. So when they get older, even up to 8 years old, it's always recommended that the parent watches over them when they are brushing to make sure they are in fact brushing all the surfaces of all the teeth for a full 2 minutes each time. And also getting in the habit of rebrushing afterwards for them. Again, I'm all for the child electric toothbrushes. They help so much. Now, where does flossing come in? Pause for a quick dental announcement. If you like teeth and you want to learn even more about teeth, I now have a weekly Toothy newsletter. There's a link in the bottom bar if you want to sign up to receive toothy tips in your email each week. Things like how to afford the dentist, teeth whitening hacks. We tackle all the dental questions that you may have, and I hope to see you there. Now back to the video, back to flossing. I feel it's important to introduce flossing early, even if the teeth don't touch. Some dentists may say you don't need to until the teeth touch, but I've found that if you start early, then once the teeth start touching, it's super easy to continue flossing because the child is already used to it. And the easiest way for a parent to floss their kids' teeth is by using floss picks as opposed to regular string floss. With the floss picks, there's lots of fun shapes, colors, and flavors out there. I wouldn't use the adult floss picks because they are usually mint flavored, and lots of kids don't like mint. They'll say it's spicy. I'm sure you've heard that before. So I'll link product recommendations for kids' floss picks in the description as well. So many links will be in that description box. And when flossing kids' teeth, don't be pressing down into the gums. No. Be sure the floss is touching the sides of each tooth. Think about it as cleaning the sides of the teeth up and down to the right a little, and then up and down to the left a little. And that's that. That was my recap of what I tell my pediatric patients' parents. If they have no teeth, wipe the gums after they eat. Once they have teeth, brush them with a grain of rice-sized smear of toothpaste. And once they have a couple teeth, start flossing with floss picks. And if you want to see what to expect at a child's first dental visit, I will also link that video of mine in the description box. A baby's first dental visit should be when their first tooth erupts and or their first birthday, whichever comes first. Oftentimes a full cleaning with the hygienist will not be done at that first appointment, usually not until age 3-ish will they have an actual cleaning. But still, when the first tooth erupts, or by age 1, it's important for the dentist to check a baby's mouth, even if there's only one tooth. It's not all about the teeth. They are also checking growth and development of the jaw, the way they bite down, the oral tissues, gums, and all that good stuff. Also, tongue ties and lip ties. I will actually link my tongue tie and lip tie articles in the description box if you'd like to learn more, because most dentists and dental hygienists are not specialists in the tongue tie and lip tie area. Some are, but lots aren't. So I always recommend my patients bring their newborn for a consultation with either a myofunctional therapist or a lactation consultant if they have any tongue or lip tie concerns. Again, I will link my articles and other resources on how to find therapists in your area, as well as all the products that I mentioned earlier. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. If you want more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.